Have you seen this viral knee injury video? Let's give it a watch.
Warning, the content in this video that I'm about to show you may be disturbing to some viewers.
Viewer discretion is advised. Hi guys, I'm Mickey with Therapy Dudes, and today we are going to break down what happened in this video and the reason why it happened. So, let's get into it. Before we go back to the video, first we need to learn a little bit about the anatomy of the knee. Now, if we take it down to the ligaments in the bone of the knee, we can see that there are two ligaments that sit inside the femur and the tibia. Now, both of these have a crisscross pattern from the front and back, and they limit the anterior and posterior movement of the tibia on the femur. These ligaments are known as the anterior cruciate ligament and the posterior cruciate ligament, or better known as the ACL and PCL. Looking at the way they're aligned, the PCL is going to prevent posterior translation of the tibia on the femur. Now, if we look at this video here, we can see that the tibia is moving anterior to the femur, which is involving that ACL, or the anterior cruciate ligament. Now, I understand that I know nothing about the medical history of this person or what all was involved in the injury, but just from seeing the video, I can tell that her ACL is more than likely torn. The reason for that is the ACL prevents anterior translation of the tibia on the femur, and if you push it too far, it can snap. So let's talk about why this injury happened. If you can see in the video, we have placement of a bolster behind the knee and in front of the hips. So we're working on the glutes in this exercise. We're sitting back in our chair, we have that load pulling us back, and we're lowering ourselves into that squatted position. What's going to happen whenever we squat, your tibia is already going to move anterior to your femur. But since we have this excess force behind our tibia, it's pushing her knee further forward as she sits back. Now, this could be a load issue, but more than likely it's just the placement of the bolster behind her knee. Now, there are a lot of other exercises that could have been done that would achieve the same results that they were going for. But it was unfortunate for this individual that it happened to her. Now, most of the time, the ACL is going to be injured in sports when someone is cutting or planning and twisting at the same time. Some of you may be wondering what happens after this. What do you do about an ACL tear? Most of the time, it's going to require surgery. So there are many different types of ways of doing this surgery. Most of the time nowadays, they use a hamstring tendon graft. They'll just remove some of the hamstring tendon to recreate that ACL. And they'll have to drill through the tibia and the femur. Now, once that is in place, we are going to have to wait a little while to let that heal. Most of the time, ACL recoveries tend to be about 9 to 12 months. There have been some athletes that have gotten back in the game at 6 months, but I would prefer that 9 to 10 month range before I get back to my sports. Talking about rehab, there are going to be multiple phases of rehab. First, we need to make sure that we're still getting the range of motion in the joints. We're going to strengthen the hips. We're going to strengthen the ankles. We're going to strengthen everything around that ACL. And we want to make sure that we have really good quad function before we are ever putting any type of weight through that ACL. Once we achieve this, we can kind of start progressing your therapy and moving towards those things that you would want to do as far as your rehab, some of the more sexier things. Then we can start looking at doing some return to sport type exercises as far as cutting, squatting, jumping. We're going to need to throw in a lot of plyometrics to get you ready to get back on the field. We'll focus a lot on single leg exercises to help build not only your strength and range of motion in your knee, but also your confidence in your knee. A lot of the athletes that I've worked with from high school, even up into professional sports, have a lot of issues with confidence in their knee. One of the reasons why you need therapy is to feel more confident in your abilities to get back to your sport. All right, guys, so let's wrap up this video with just a few things that we want to go over. Yes, this was unfortunate that it happened to her. It was a learning experience for not only her, but it is also a learning experience for the rest of you viewers. I hope you found this information helpful. Just make sure you like, share, and subscribe to Therapy Dudes. Okay, guys, that's going to be it for this one. Please, please, please be safe out in the gym and be safe in your sport. Have a great, great day.